In your morning medical news, although it may not fully feel like it yet, summer break is finally here, meaning many families will take a dip in their local pool, lake, or beach. But experts urge you and your family to stay safe. Every year in the U.S., there are more than 4,000 unintentional drowning deaths. But drowning is preventable. Mandy Gaither talks to a doctor about how the ABCs can help you remember how to keep kids safe while swimming this summer.
It can happen in seconds. Drowning is often silent, and many times it's children who are the victims.
The most common drowning is in the kids age 1 to 4. They slip into the water and go under, and that's it.
Dr. Donald Plumley with Orlando Health says the ABCs of water safety starts with A for adult supervision. When children are in the water, an adult should be paying full attention. Avoid distractions from people or phones. You may also consider designating a water watcher.
Almost like a designated driver. You want a designated watcher watching your kids. Take turns doing it. It gets tiring, but someone needs to know that's their full-time job.
B is for barriers. Plumley says there should be a fence around pools, especially when you're on vacation or renting a home you're not used to. He says to make sure there are safety features in place before you go. Finally, C is for classes. Both the parent and the child should be in swim classes. Plumley says to start as young as a few months old and make sure children are up to date every swim season.
Even though they took them last summer, it's good to do it again this summer, get a refresher course going. And then for the parents to learn CPR, should the tragedy ever occur or be around a tragedy, you're there to help. And start care right away will make a huge difference.
Dr. Plumley says children with special needs have a significantly higher risk of drowning, so he says to be aware and have a water safety plan in place. Doctors are looking into whether popular weight loss drugs could help prevent cancer. A study published by the American Society of Clinical Oncology showed that because obesity is linked to certain cancers, people with diabetes who take drugs like Wegovy, Ozempic, or Zepbound have a 7% lower risk of cancer and an 8% lower risk of death. Our immune systems are stronger during the daylight hours. A study by the University of Auckland found the white blood cells that help prevent infections are more effective in the morning hours. Researchers say this could be an evolutionary response since we're more likely to encounter bacterial infections during the daytime. A new study is finding that going for that snooze button when your alarm goes off may actually be causing you to lose sleep. The average snoozer tallies an extra 11 minutes in bed after their first alarm goes off, but the study's author says that isn't usually quality sleep, and those minutes can add up to about a night's worth of sleep loss per month. So what can you do to avoid the snooze? Set that first alarm as late as possible.